So we move on to part 3 of this controversial, I would have to say, idea. Is it safe to take supplements during cancer treatment? Oncologists nearly 95% of the time say stay far, far away. There's nothing safe to take during treatment. So we've been reading various parts. Upcoming tomorrow, we're going to look at vitamin C and its role and how important vitamin C has been in cancer treatment. And we're going to end up this week talking about Avamar Ultra, one of the most breakthrough products for cancer treatment that I have ever found. Treatment. Give you the numbers to reach us off air if you have questions or comments, or you want to discuss this with me concerning your issues. And anything you do here on this show, make sure you understand. Do not make those decisions without talking to a registered healthcare provider. Okay? We'll get started here in a minute. The information you hear on Health Talk with Dr. Len is intended to be strictly educational and is not intended to diagnose or treat any disease. Any medical decision should be made between you and your healthcare professional. And now, here is Dr. Len. And again, we're going to be quoting today by Dr. Sharon Palmer, a registered dietitian actually, that did an interview and research work on a Dr. Keith Block, medical director of the Block Center for Integrative Cancer Treatment in Evanston, Illinois. And we'll be talking about that in 1 second. Lay off your vitamins and dietary supplements is a common advice patients with cancer receive when they start treatment. Some healthcare providers have even been known to take it a step further by suggesting that their patients avoid fruits and vegetables. Why would those words pass any health expert's lips? It all boils down to what Keith Block, MD, medical director of the Block Center for Integrative Cancer Treatment, Evanston, Illinois, calls the debate over antioxidants in cancer treatment. Do antioxidants help normal cells, or do they help tumor cells to thrive? Do they interfere with the therapeutic effect of chemotherapy? These are big questions being raised in the oncology world, and there's no easy answer. Cancer experts seem to be split into two camps on the antioxidant issue. One side believes taking antioxidants during cancer treatment may interfere with chemotherapy and radiation by reducing their efficacy. They say that radiation and chemo induces oxidative stress and kills cancer that way. Radiation and some chemotherapy agents work by generating free radicals that kill rapidly dividing cancer cells. Since antioxidants scavenge free radicals, the thinking is they may interfere. The other side of the argument is that oxidation supports the normal growth of malignant cells, which may conflict with treatment. Thus, antioxidants may counter the harmful effects of oxidation in the malignancy process, boost the effects of cancer therapy, and protect patients from the therapy's toxic side effects. In some circles, there's mounting support for using antioxidants during cancer therapy. Dr. Block, who spoke at the 6th Annual Nutrition and Health Conference in Chicago, concedes that there is controversy about whether antioxidants protect normal cells or cancer cells. But he believes antioxidants should be administered with chemotherapy because oxidative stress initiates and promotes cancer cells. Cancer patients often have low levels of antioxidants, which increase their susceptibility to side effects. And oxidative stress promotes cytotoxicity and serious side effects. To provide evidence-based science on this issue, Block conducted 2 systematic reviews. As discussed in the May 2007 issue of Cancer Treatment Reviews, his research team conducted a systematic review of published studies examining the effects of antioxidant supplements and chemotherapy. 19 of the 845 studies meeting all the evaluation criteria for the review. The researchers concluded there is, you ready? No evidence supporting the theory that antioxidant supplements interfere with the therapeutic effects of chemotherapy agents. None. Then why does my doctor continually say that? Because they don't know. The review found that antioxidants may help increase survival rates, tumor response, and the patient's ability to tolerate treatment. Some of the antioxidants used in the trials included glutathione, amen, vitamin A, C, E, ellagic acid, selenium, and beta-carotene. In the second systematic review examining the impact of antioxidant supplements on chemotherapeutic toxicity, 33 of the 965 studies met the inclusion criteria. Antioxidants evaluated were glutathione, melatonin, yes, an antioxidant, vitamin A, an antioxidant mixture, N-acetylcysteine, vitamin E, selenium, L-carnitine, coenzyme Q10, and ellagic acid. The majority of the studies, 23 of the 33, found evidence of decreased toxicities from the concurrent use of antioxidants with chemotherapy. Again, it's the toxicities of chemo that tend to cause the major side effects. 9 studies reported no differences in toxicity between the 2 groups. Only 1 study on vitamin A reported a significant increase in toxicity in the antioxidant group. Again, we don't normally recommend vitamin A. 5 studies reported that the antioxidant group completed more full doses of chemotherapy and had less dose reduction than control groups. Their findings were published in the International Journal of Cancer back in 2008. How quickly we forget. According to Block, these reviews largely support the notion that antioxidants enhance treatment outcomes, increase survival time, and increase tumor response. The majority of the studies show that the antioxidant group had decreased toxicities. Antioxidants and chemotherapy are safely recommended for metastatic and palliative care patients, and there was no significant decrease in treatment efficacy. No, zero, none. Dr. Kedar Prasad, PhD, founder and the Chief Scientific Officer for Premier Micronutrient Corporation, is another leader in the realm of antioxidant therapy during cancer treatment. In 1979, he was the first to show that vitamin C can enhance the effects of radiation and chemotherapeutic agents on tumor cells. In 1982, he discovered that vitamin E succinate, it's a very specific form, was one of the most effective forms of vitamin E for killing cancer cells, but not normal cells. The controversy over antioxidants in cancer therapy is not justified. It's a theoretical controversy because there is no data that will show that therapeutic doses of antioxidants, that's a key word, not tons, therapeutic doses, do not cause any kind of complications or enhance the effects of therapy. Dr. Prasad said, clinical studies showed that people using chemotherapy experience severe peripheral neuropathy, and high doses of vitamin E markedly decreased neuropathy. In cancer of the head and neck, radiation-induced damage was improved by therapeutic doses of beta-carotene, and it didn't interfere with the therapy. Dr. Prasad explains that the mechanisms by which antioxidants may help in cancer treatment go beyond the prevention of free radical damage. Antioxidants function to prevent free radical damage, and that's important. But at therapeutic doses, it's a key word, not excessive, therapeutic. There are other mechanisms such as induced apoptosis, decreased inflammation, and an enormous change in gene expression, said Dr. Prasad, who stresses that it's important because during chemotherapy, the body's tissues are damaged by the production of free radicals and by severe inflammation. Dr. Prasad limits his recommendations for antioxidants during cancer treatment to therapeutic doses, there it is again, therapeutic doses of dietary antioxidants such as A, C, and E, and beta-carotene, because other antioxidants made in the body, such as sulfhydryl compounds like alpha-lipoic acid, may present toxicity concerns. So there are a select few that need to be avoided. This is an outstanding article. April 2010. I've carried this one for a long time. And we'll get back into that again tomorrow on part 4 of this study. So make sure you go back and listen to all the other parts. You can find those all on Spreaker.com, or wherever you're listening right now, or at the website Nutrifarm, PHARMLLC.com. Check it out. And again, that number to reach me off air, 888-231-5325. God bless you, folks. Have a great, healthy day. See you back here tomorrow.